All right, in tonight's toolkit, A Key to Your Health, we're talking heart disease, and we're talking about heart disease in kids, not grown-ups. There's a growing interest among doctors in the number of young people with heart conditions, and this has led to a controversial call from one doctor for all sixth graders in the U.S. We're talking 11-year-olds now to get routine heart screenings. Dr. Keri Peterson from Lenox Hill Hospital is here with us now to sort this all out. This all started with a cardiologist in Houston, right?
That's right, Kaity.
What does he want?
Basically, John Higgins out of the University of Texas decided to look at whether screening 11-year-olds for heart conditions with electrocardiograms and ultrasounds actually detects heart disease. He looked at 94 children, 11 years old, and of the 94, 5 of them were found to have a minor heart problem, and 2 of them were found to have heart problems severe enough to require surgery. There's also another program that's being done out of Illinois. This is a fantastic program called Young Hearts for Life. They decided to look at high school students. They looked at 22,000 kids, and they found, in high school age, they found that 400 of those, just with electrocardiogram, had an abnormal electrocardiogram, and that 22 of those were found to have heart conditions.
So why aren't we testing kids in our area if this is indeed the case?
Like, I guess similar to the mammogram debate, whenever it comes to a screening program, you've really got to weigh the upsides versus the downsides. And in this particular case, the downside in particular is cost. So Dr. John Higgins was able to get the cost down to $150 per child.
But normally it costs much, much more.
That's right. In the real world, it would cost about $1,000 per child. And then the question is it worth it to spend this kind of money when you're detecting still a relatively few number of cases? Okay,
so not to alarm parents unnecessarily, just how worried should they be, and what should you do? What advice are you giving parents with kids that age who may be playing sports?
These are still relatively small numbers, so I don't want parents to be alarmed, but what I would advise them is to look for symptoms that may be warning signs for heart conditions. And these symptoms generally occur during or after exercise. And this is dizziness, fainting, even fainting during emotional distress, chest pain, and excessive shortness of breath. And in addition, if you have a family member that has had sudden death due to exercise or under the age of 50, this is also a red flag for your child to get tested.
Thank you so much for that information.
Thanks, Kaity.
It's always good to see you.
You as well.
Keri.
Thank you.
Come back again soon.